Today I'll explain the five phases of the cardiac cycle and how each phase connects to what we see on on ECG or EKG slash electrocardiogram. The cardiac cycle refers to one whole heartbeat. It includes the diastolic and the systolic pressure. Systolic is the contraction phase, and the diastolic is the relaxation phase. Both of these phases involve the coordinated activity between the atria, the AV valves, the semilunar valves, and the ventricle. Phase one is the atrial relaxation and ventricular filling. Basically, the early systolic. During this phase, both the atria and the ventricles are relaxed. Blood is returning to the body and fills up the lungs to the atria and it flows to the ventricles. The AV valves are open and the semilunar valves are closed. The AV valves are the tricuspid and the mitral valves, also known as the bicuspid valves, and the semilunar valves are known as the pulmonary and aortic valves. On an ECG, you would typically see the flat baseline after the T wave and before the P wave. There's no heartbeat sound during this phase. The second phase is the atrial contraction and ventricular filling. This phase causes the atria to contract and push their blood into the ventricles, allowing the ventricles to be completely filled and contract. Typically on ECG, you see this as the P wave, which represents the atrial depolarization. The atrial contracts immediately after the P wave, forcing the AV valves to stay open and the semilunar valves to stay closed. And in this phase, you would not hear a heartbeat sound, although sometimes, in some cases, an F4 may be present in abnormal conditions. Phase 3 is an isobalanced contraction, marking the start of the ventricular systole. The ventricle begins to contract and no blood is ejected yet because all the valves are closed. As pressure starts to build up in the ventricles, the AV valves close to prevent the backflow of the blood into the atrium. The close of the AV valves produce the heart sound, also known as a lub sound, and on ECG, this phase immediately is after the QRS complex, which also represents the ventricular depolarization, and the semilunar valves also are still closed at this point in the phase. Phase 4 is the ventricular ejection. Once ventricular pressure exceeds once the pressure exceeds the pressure in the aorta and the pulmonary artery, the semilunar valves open. Blood is forced through the left ventricle into the aorta and from the right ventricle into the pulmonary artery. The ventricles are in full systole during this part of the phase. This would be represented as a QRS complex on the ECG and the continuous through the T wave, which also represents the ventricular repolarization. And during this phase, you would not hear heartbeat sound when the semilunar valves are open. The last phase is isobalanctic relaxation, which begins in the distole. The ventricles relax after repolarization, and this is often heard as the dub sound or the ST sound. The closure of the semilunar valves produce that second heartbeat sound. As the ventricular pressure falls, the semilunar valves close to prevent the flowing back into the ventricles. During this time, all valves are closed until the ventricular pressure falls low enough for the AV valves to reopen, thus restarting the cycle. The cardiac cycle is carefully coordinated in a sequence of activity, mechanical contraction, audible heart sounds, and valve movement. The atria fills the ventricles during distoling. The ventricles stay contracted during this to allow this to pump blood to the lungs and the body, and opens the AV valves and closes the semilunar valves to create the S1 and S2 cell, also known as the lambda cell. Understanding this between the ECG waves and the jaw function is essential for recognizing a normal functioning